doesn't work. So the history. The history is a 48-year-old non-diabetic Hispanic man presented with the left leg wound. He has a past history significant for hypertension, hyperlipidemia, gout, and bilateral cataract surgeries. His medications, most of them you know already. Benicar hydrochlorothiazide for enterocolic and ibuprofen and arteridol for gout. On physical examination, he had and moon faces. Also, he had purple stria and gouty tophi. So, what is the diagnosis? Can anybody from the audience tell me? Pharmacia. Pardon? There you go. It's Cushing syndrome. So if it's a Cushing syndrome, it has to be some extra cortisol. So where is extra cortisol coming from? So we hired an expert of medical detectives to find the source of this extra cortisol. This is Mr. CSI Chicago. This is Mr. Pink Panther Senior. This is Mr. Pink Panther Junior. And this is a tune. While playing this tune, we discovered that we should do some investigations. So it's time for investigations. Let's do some investigations. Random cortisol in the suppressed range. 24 urinary cortisol, as you all can see, it's in the normal range. Overnight dexamethasone suppression test, again in the suppressed range, and plasma ACTH, again in the suppressed range. So if the plasma ACTH in the suppressed range and random cortisol is in the suppressed range, what can be the cause? It has to be exogenous corticosteroid source, which is causing this Cushing syndrome. And looking at the clinical picture, he has Cushing's. So, can anybody want to take a guess? What can be this exogenous source of the Cushing's? Oh my God. Well, yeah, it's an arteridol. It's a drug. It's a combination of indomethacin, metocarbamol, and betamethasone. Our patient was taking this drug from last 1.5 years for gout from the back door pharmacy without prescriptions. So let's talk something about this problem. Availability of medication without prescription is a growing problem in the United States in recent times. Annually, around 2 million of US adults import prescription drugs without getting a prescriptions annually. It's greatly facilitated by internet, as you all know, and some local pharmacies sell medications backdoor. And obviously it poses a great threat both to the healthcare industry as well as our patients. This is a slide that shows some data about the extent of this problem. 185 web pharmacies in 2006, only 2 were verified by the National Association of Boards of Pharmacy. 9 out of 10 sold controlled substances without prescriptions, and unfortunately there is no solid data available for backdoor pharmacies. The reason for this is because in the front, these pharmacies can be music stores, can be grocery stores, it can be bakeries. On the back doors, they sell this medications without prescription to the patients. This is a slide that just shows the most sold medications from these pharmacies: Ambien and Xanax, which are the sleep medications and anti-anxiety medications, and then followed by the pain medications, hydrocodone and Vicodin, followed by Viagra and so on. What's the modus operandi? What's the mode of operation of these pharmacies? This slide shows just the one way of the mode of operation of these pharmacies, but there can be many ways. What these pharmacies like? I just want to talk about this slide a little bit. The Pfizer, a pharmaceutical company, controls the manufacturing and marketing of the Viagra in US. The pill costs $10 and it only comes with prescriptions. The patent is expired for Viagra, so it can be made cheaply in countries like India and Mexico on mass basis. What these pharmacies do is they hire the spammers. The spammers send millions of emails, and when the email recipients, whether they are important, they are just curious to know, they click on these links that are directed to the website of the pharmacy. They order these medications. If they order this medication, the sale is made from the non-US supplier to the pharmacy. This pharmacy ships the medication to the email recipients, and the commission, which is can be 40%, it goes to the spammers. It's a very big business. We don't have any idea how big this business is. So we should always have this in mind. What can be dangerous? Did you hear that? It's yelling Tarzan. You can have wrong medication, wrong dosages, adverse effects, like this patient. You can have buried head syndrome, like this gentleman. Or you can get financially ripped off. It's a dollar sleeping phenomenon. No drug shipping, only dollar shipping, which means that when sometimes you order the medications don't ship, you get financially ripped off. And they all are laughing with your money, they steal your money. What can be done to tackle this problem? We should be always aware of the possibility that this problem can happen with our patients. Thorough history and physical exam, as always, and check medication list, which is most important step to tackle this problem. Patient awareness and counseling is also another important thing. If they have any doubt, they can check with the National Association of Boards of Pharmacy and FDA websites. Tons of information is available on their websites, and they can get the list what to order and what not to order from the online pharmacies. Recently, I have heard that some of these local pharmacies who sell medication backdoors have been sealed off by the local police in Las Vegas and San Francisco, which happened in last 2 months, around February 2008. The take-home message for this presentation, for this problem, would be to communicate with your patients properly, thorough history, physical exam, and checking the medication list completely. Those are the very inexpensive and important steps to do to tackle this problem. And at the end, Dr. Mario on my behalf says thank you.